good comments this morning, some good questions. But first, let's get our Adelup Press Secretary, Crystal Paco, on the show. Good morning, Crystal.
Good morning.
There you
Good
go.
morning, Bree.
So I guess just right off the bat, the biggest news that came out around 8 o'clock last night, 12 new confirmed cases.
Yes, 12 new confirmed cases. And, of course, our one fatality yesterday. We mourn with the family, and we also hope this sends a strong message to the community that we need to stay home, and we need the nurses and the doctors and our healthcare professionals to do their job, our investigators at public health to do their job. And just we ask the community, stay home. If you're not essential, stay home. That's the best way to contain COVID.
I think what was really shocking, aside from the numbers and the fatality, was when you issued that press release that notices of violations were being issued. It's like you said, a lot of people aren't heeding this order, and it's just insane. I can't believe it.
It is. And, you know, we have that number I provided in that press release about I can provide you that number right now.
It's a 9.
It's where to call. If
the phone number.
Somebody operating and they shouldn't be operating.
Right.
That number goes straight to Adelup. We have staff, working so we can answer the phones. We can report businesses that shouldn't be open. If you're not a grocery store, if you're not a restaurant with takeout or grab and go, if you're, I'm seeing it was a vape shop. There's a few vape shops.
A couple massage parlors. I mean, I know we're all stressing out and we could use a massage, but I mean, that's just ridiculous.
It is. And so those are the numbers to call. DRT is actively enforcing. We have the notices of violation. I expect many more in the coming days. As people, we need to send the message to people, stay home. Right now is not the time to do business. Now is the time to stay home. And that's the number one message from the governor.
Crystal, is the governor and are you guys going to be ramping up enforcement of this mandatory social isolation order? Because it looks like through the weekend, you're right, people were not taking it seriously, and it shouldn't take a COVID-19 death for them to do that, unfortunately.
And I think people are starting to get the message. I watched your newscast last night. One of our individuals in one of the mandatory quarantine, he definitely changed his tone, and it was a very sobering message that he gave to the community. So thank you for sharing his profile.
Yeah, we're actually going to be checking in with him every day. That's Dave Sablon. He was a former photographer for KUAM. But you're right. He even messaged me last night because he wasn't aware, and he was like, "Bree, is there 27 cases now on Guam?" And it was hard, and I know it's hard for you. Like, we go to sleep, we get up early and then go to sleep, and having to share, news like that to the people.
Crystal, what can you tell us, if you can tell us, the status of the investigation? So now, judging from the release that you guys put out last night, we're understanding that obviously there's going to be some type of trace investigation into Holiday Bingo. Did that investigation and the start of it kind of intersect with any other trace investigations that were going on with public health, whether they be connected to previous positives or that flight from the Philippines that you guys had February 29th, right?
Yep.
Yes. So that Holiday Bingo hall, yesterday after we received news of the additional cases, and we were able to track that Holiday Bingo was where at least 2 confirmed cases had frequented. And so that is why we put out that call out after vetting the information, of course, March 6th to March 16th. If you had gone to Holiday Bingo Hall, and please just stay home. If you have flu-like symptoms, please call our medical triage hotline. There's a list of numbers. I'm sure you guys are announcing those numbers frequently. Those are manned by public health nurses, and they can help direct you, if you have flu-like symptoms, what to do next. If you don't and you frequented the Holiday Bingo Hall, please stay home. Wait it out. Let's all get through this as a community. Again, the Guam has gone through a lot of events, very typhoons, World War, and we will get through this. But right now is the time to get through it alone in your house. Again, social distancing directive totally in effect right now.
Right. Chris,
do you guys have an idea how many people we're talking about that went to this bingo hall between those times? Just a rough figure.
I'm not sure what the capacity of that bingo hall is. I did, do some personal Google searching last night, and I did see it's a big space.
It
is.
Yeah. So I mean, God, we're talking at least hundreds of people. If you've ever been to bingo with Tan Chai, that it's crowded.
And again, we want to send a message. Please protect our Manusco stay. stay limit your visits with them if you're not their healthcare provider. Actually, I saw a very sobering image on Facebook. My friend Roxy Sanford, she was showing me. She posted pictures of her and her kids and her parents, and they were looking at each other from a sliding glass door. Grandma and grandpa were in the house in a sliding, and they could only touch the grandchildren through the sliding glass door.
Mm-hmm.
So that's the severity of this. We want to make sure we protect our Manamco. Again, they're the most vulnerable. Yesterday's fatality, she was 68 years old. Comorbidities existed, but we want to make sure that our Manamco are safe in this, and that COVID-19 would aggravate on any other existing condition.
Crystal, are you guys getting a lot of calls from people who were, because we had a comment here from a woman who was at the Hafaday Bingo Hall during that time. We've told her to call the numbers. Are the phones ringing maybe since last night into this morning? Do you know?
They will start ringing like crazy, I imagine, starting 8 o'clock. I'm not one of the ones answering the phones. I'm not one of the nurses, but I imagine it's going to be crazy day to day.
Hey, and then Crystal,
Panic sets in.
we also wanted to ask kind of mixed messages, right? So we have this mandatory social isolation order. We're telling everyone to stay home. And then we're hearing from one side of the government that, no, you can come and, pay your power bill, your water bill through drive-through. I know that you guys aren't the CCU, but I was under the impression that there was some kind of deferment that had come out with the governor's economic plan, the team plan. Can you maybe clarify that, or have you guys been talking with them, or is that okay for people to just go and pay their bills now?
There is always the option to pay online, and so I would definitely recommend that. As for the CCU and our Team Guam effort, I could get someone from our fiscal team to speak more in depth with you. Maybe
Okay.
Ricky Hernandez, he's the one leading the Team Guam effort.
Right. Hey, and then I guess the other question we had, and I know this has got to be something that has kind of entered you guys' mindset. Talking with Mary Rhodes last week, she was telling us that she's already been informed to prepare for an extension of current conditions after March 30th. Is that a conversation that you guys in the administration have started having?
You're probably tired of hearing this, Chris and Bree, but it's an ever-evolving situation. So, March 30th is what we've set right now, but we could likely extend it should we find more cases and if the spread continues.
Right. There was something else that Mary had said, and that was that every time there is a confirmed case, the clock starts all over, and it's 14 days. So I think maybe you guys could provide clarification on that later on.
That's
today.
true. Much like dengue, it's like the clock starts over. You need to have so much time between
Mm-hmm.
the last confirmed case. So 14 days. Again, we know that we know that the incubation period is roughly 14 days. Why people tell you to stay home for 14 days?
Right.
Quarantine. So every time we start the clock again. So we could likely go a few months like this
Right.
at this rate. If the community doesn't take it seriously to stay home and stop the spread.
I know we talked about this also last week about communication with the mayors and their request to get notification when there are cases in their village. And I know your dad's a mayor. So
Yes, my dad's a mayor.
right, and so we just spoke to Mayor Hoffman again and Mayor Louise again, and she hadn't even been contacted about the Hafaday bingo hall. Where are you guys in terms of opening this line of communication and being more transparent with the mayors?
Of course, Bree and Chris, if I showed you a map of Guam about the affected areas with COVID, I'd show you the entire map of Guam.
Right.
And so we should all act as if we have COVID and stay home. Again, with the holiday bingo hall, I have to be honest. I found out via text message, and that's what a reality is that social media is faster sometimes than I can even keep up. And although our team is doing our best, Hafaday Bingo, I found out through that WhatsApp group or that WhatsApp message that was going viral, and I had to confirm it. And once I did, we put out the information. So I definitely think that we have room to improve. It's a new week. It's Monday. I'm now in the mayor's chat, and so I can actively speak with them myself. They all know my phone number. They also are very familiar with the JIC and how to get information from us. But I definitely think we need to maybe work on a daily teleconference if we have to. I'm not sure if the mayors are on FaceTime or on Zoom, so maybe just a phone call, to Mayor Savares or Mayor Hoffman every day or every other day, and I think we could do a better job at communication.
Right, and we're so glad to hear that, Crystal, and we've seen the communication improve by leaps and bounds. We had mayors, doctors, media residents calling for it, so we're definitely happy that you guys realize that arming people with information in a timely manner really just you don't want to go into war without weapons, and information is a valuable weapon to
Knowledge
have.
is power.
Yeah.
Knowledge is power. And Chris and Bree, I can tell you that we have a PSA coming out a little later today. We shot it yesterday with the doctors, just sending out that message: practice good hygiene, stay home. And we want to show the community that our doctors stand united in this effort. And we need to make sure that we are able to keep our front line strong. So if the numbers keep going up, our front line, you're going to really hamper our ability to respond.
Crystal, what can you tell us about the number of tests that we can conduct daily? I'd heard something about 20, but last night you guys were able to run 35 tests, correct?
Most definitely. I can give you that. So a few days ago, I think it was a Saturday or Sunday, I'm sorry, my days are blurring up together. We reported that we received 200 test kits from the CDC. We're able to now, we've built our capacity to test as many as 40 tests a day. We've added a lab tech to do that. It was a personnel limitation. Now we've added that limitation. We've added that staffer, so we can test up to 40 a day. You saw 2 batches that were run yesterday. That resulted in the first batch with 11 positives and the second batch with 1 positive. So if you're counting down, we had, again, I was hesitant in the beginning because it's an approximate number. They're going to be inconclusive results. There's going to be those test kits that are needed in validation. But 200, we started with 200 on Saturday. You count 40, and then the ones that were done prior to that, we're quickly depleting with our resources. And so that's why we have to emphasize that only those who are asymptomatic, or those who are symptomatic, with the most vulnerable, those that may be treating our sick, are the priority, and those in contact with confirmed cases that are sick are our priority for testing. We do have contingency plans in place. Our director for public health, Linda Pinko Denorsi, she did sign a contract with DLS. We're working with private and public labs in the states to be able to send our tests. So in the event we run out of tests here, we're able to send it off island. And that's what other areas are doing. Guam has had the luxury of being able to test locally, unlike some of our brothers and sisters in our region, who we are just, when we take, I think it was the CNMI that issued a press release yesterday saying that they send their tests to Guam. Yeah, they send it to Guam, but we don't test it here. We do not test their test here. We send that off island. We only repackage it and send it off island. So again, Guam has had this luxury of testing our own. Once we lose that luxury, we're going to be sending it off island as well.
Right. And that's just too much of a gap in between testing and results. Crystal, what can you tell us the number of tests you were able to run yesterday? Are you able to tell us if the large number had anything to do with any of the trace investigations, or is this just you guys testing, 35 people who showed up at different clinics, with the symptoms?
I can't really say. I need to speak with our surveillance team. I'm not sure if those were just PUIs that walked into the hospital or if those were results of the contact investigation.
Okay. Well, Crystal, I know you're about to go into your briefing. We know that you guys have committed to 2.
Actually, we've changed our 7:30 briefing. I need to go into the shower, Chris.
Okay, so
TMI.
Yeah. All right. So I was going to tell you to wash your hands, but I think you're good.
I'm gonna wash my hands in 20
Okay.
seconds. So there's a lot of songs you can sing for the 20 seconds.
Right.
All right.
Okay, Crystal. Thank you.
Thanks, Crystal.
Chris, thanks, Bree.
Okay. We'll see you. Crystal Paco San Augustine, of course, the Adelup press secretary. So, yeah, they got